Hi everyone, welcome back to my YouTube channel. So in today's tutorial we shall be doing how to check blood pressure. So in today's video we shall be discussing how to do a blood pressure. So before you start the procedure, make sure that you introduce yourself to the patient and you explain the importance of doing that procedure to the patient. Then you gain consent about to continue the procedure. Then before you start doing the procedure, make sure the patient should be sitting in a well comfortable and quiet area. Never take a blood pressure in an open place where the sun is extremely hot, right? So do not take or do not measure a blood pressure in an open place whereby the sunlight is extremely hot. Okay, before you start taking the blood pressure, make sure you instruct the patient maybe to have a deep breath or to have resting at least 5 minutes, and ask the patient if he has maybe any form of urination, because if the patient has in the state of being going to the toilet, so like you may put pressure on the pedal and that can elevate the blood pressure while it is not high, so it can give you wrong value, right? So the patient should rest at least 5 minutes before you start checking the blood pressure, right? So the patient should be comfortable and the place should be very quiet and very cool place. So we shall be starting now our procedure. And make sure the hand is like this. The hand should be like this, but not like this and not like that. And the hand should not be like this. Ensure that the hand is above the level of the heart. So the hand should be in between the level of the heart. So this is how you are going to measure. And make sure the rope of the calf should be in between in the front of the elbow, right? So the rope of the calf should be in between on the front elbow. Then you roll like that. So this one the patient's hand should be like this. Then now you start measuring your blood pressure. So avoid reading the results before it starts stopping, right? So only read the results after the reading has stopped. I hope you can see now the reading is going. So we shall be waiting until it stops. I hope you can see it clearly. The reading is still going. So you can see our systolic is 105 and our diastolic is 48. Our pulse rate is 72. So obviously this blood pressure reading is normal. So it's normal, obviously. So you can repeat until 3 times for you to confirm if the patient or if this reading is correct or not, or if the patient has a blood pressure and the machine is giving you wrong value, right? So you check it after 3 times, then you can tell the patient if he has a blood pressure or not. So now how do you know if someone has a blood pressure? So let me explain it now clearly. Okay, let me explain the reading that we have gotten. So in our reading it was the upper one 105, that is the systolic, and the diastolic we have gotten 48, and the pulse rate was 71. So let me explain if someone has a high blood pressure or if someone has a high pulse rate. So let me explain. So in blood pressure, a normal blood pressure is 120, that's the upper one, and the lower one is 80 mmHg. So if a reading is 120 or less than, and that's the systolic, and the diastolic is 80, the blood pressure is normal. So when you look here, so 105 is less than 120, this means that the blood pressure is normal. But when you see the diastolic 80 and 48 is less than 80, so this blood pressure is normal. But how can you know if someone has a high blood pressure? So a high blood pressure can be a reading it can be a reading greater than or equal 140, that's the systolic, and a reading greater than 90, that's the diastolic. You can say that the patient has a high blood pressure after checking it 3 times for you to confirm if the reading is accurate, right? So make sure you check it 3 times to confirm if the reading is accurate. So a high blood pressure can be a reading systolic greater than 140 and diastolic greater than 90. So you can say that this patient or person has a high blood pressure. So if the reading is less than 120 and 80, so that the blood pressure is normal. So what about if someone has a high pulse rate? So a high pulse rate can be a reading greater than 100 per minute. So if the patient has a reading of 100 greater than 100 per minute, so the pulse is very high. So this is how you are going to interpret the results. So whenever you are reporting a blood pressure or whenever you are reporting the result of vital signs, make sure you write all the expected values or the reading. For example, whenever you are reporting blood pressure, ensure that you have written this mmHg, because a blood pressure is measured mercury around the surrounding. So mmHg represents mercury around the surrounding. So B stroke minutes represents per minute, because the heart beats 72 times per minute. So whenever you are recording, ensure you write these values per minute mmHg. But if you omit writing this value, so the doctor or the health care provider cannot identify if this one is a fever temperature, or if this one is the pulse rate, if this one is the blood pressure. The doctor cannot identify. So ensure, if you're a nurse or if you're a health nurse, whenever you're recording this result, ensure that you write these values against the reading. So you write this marks against the reading. So this is how you are going to report. So if you see a blood pressure reading that is greater than 140, the systolic, the upper one, and greater than 90, that's the diastolic, the low one. If the reading are higher than this, then the patient can have a high blood pressure. What if someone can have a hypertension crisis? So a patient can have a hypertension crisis if a reading is greater than or maybe 180 over 120. So this can be a hypertension crisis. The patient needs immediate hospitalization. So if you see a reading that is greater than 180 all over 120, so the patient has a hypertension crisis. So he should be reported immediately in the hospital. So this is how you are going to interpret the results of blood pressure. Thanks for your watching and have a nice day.